Good morning. My name is Arianna Barrios, and I am the Administrative Director for OCTax. And this morning, we are joined by Supervisor Don Wagner of Area 3 in the County of Orange. Thank you, Supervisor Wagner, for joining us today.
Pleasure's mine. I appreciate the opportunity to chat with you and everybody out there in the cyber world.
So obviously there are a lot of things to go over, but I want to give you first dibs and just say, how's it going to the county? You have a lot on your plate right now.
Well, perhaps you've heard about COVID-19, and we are all COVID all the time pretty much at the county. The response out in the community has been fantastic. We've had people not only voluntarily complying overwhelmingly with the orders for wearing masks, and wearing masks especially in public, staying home to the extent possible. We're also seeing people come together and make offers to the county. How do I help my neighbors? I may be able to get more N95 or the KN95 masks or gloves. How do I get those into the hands of the first responders and the people that need them? We've seen an overwhelming response from the county, and good on you, Orange County, because people are coming together and helping each other get through.
And how about just all of the county employees? I mean, the operations center is going, you have lots of folks doing different kinds of jobs and juggling things. How is the staff doing?
Well, the staff is again responding quite admirably. We had the Emergency Operations Center open and running from day one. I've been up there a couple of times to essentially serve as the liaison with the Board of Supervisors and oversee what's going on there and participate in those discussions. We've done a number of those calls remotely as well. Everybody is, to the extent possible, working remotely, and so that operations center has been up and it has been humming. It's quite something to see in operation. And then throughout the county, we've had reports of folks working remotely as best as possible. We have, when they come in, everybody's wearing masks. The county has distributed multiple masks to every one of our employees who are on site in any of our county facilities. And we are finding people working very hard to keep doing their jobs and to, again, respond to the extent humanly possible to a crisis that is unprecedented, at least in any of our lives.
So that brings us to what's going out in the communities. So this weekend, we saw a number of protests pop up across the county. I think it goes to, we've been a month, it's been a month at this point, which it already seems like it's been this way forever for a lot of people. But what does that say to where people are at in terms of, the epidemic?
Well, I think folks are getting ready for us to lighten our hand. And I'll tell you, I share that sentiment completely. I am watching those protests. They're in a number of communities right here in Orange County. Of course, they're also outside of the county. Throughout the state, we've seen them in Ohio, we've seen them in Michigan, for example, and in other places. I think people are looking at the situation, saying that, and it seems to be right, that we've gotten a bit of a handle. We're not out of the woods yet. There's a lot more work to do, but a bit of a handle that it's time to start thinking about what are our next steps. How do we start reopening things? How do we do that in a way that is as safe as humanly possible? Because we've got to get this economy back into operation. We've got to get people back working again.
Well, let's dig into that, because obviously for OCTax, that's a big part of it. At this point, even if we reopen, it's not going to be everything's the same as it was. We're going to kind of limp into a reopening as different things get opened at the same time, but we have a lot of small businesses that are hurting. A lot of people didn't get the paycheck protection plan. They didn't get opportunities to get those loans. What are we to expect in terms of what our economy is going to look like?
That's a very large question.
Sorry.
And if I had a crystal ball, I'd be able to tell you. But at this point, all we have are sort of the outlines of what that looks like. Let me say, first of all, you mentioned the Paycheck Protection Act. It's my understanding that there is a new Paycheck Protection Act, or at least an effort to fill it back up because the funds are depleted, that is working its way through Washington, D.C. To the extent you can contract your representatives and get that effort moving forward at a much faster pace, that would be a useful thing to do. So those sorts of things are coming. There's also talk of an additional stimulus out of DC that we hope will pass and will allow some of the cities in particular to benefit from the federal efforts to get us back to something close to, but it's only close to normal. When you talk about some of the small businesses, when you talk about reopening the economy, you got to realize that Orange County is in a better position than any of our surrounding counties from a health standpoint. And that's not me talking, that is a couple of UCI professors who did a study. It was published in the Register Thursday or Friday of last week. And you can see when you look at the curve of this disease, Orange County's results are much better than any of our surrounding counties. When we reopen the economy, we want to make sure that we don't undo all of those successes, for lack of a better word. That said, we've got to start opening, and we've got to start it soon, because the losses that we're seeing don't get made up.
No.
The meals that restaurants didn't serve, you're not going to go eat them again. The transportation, we were talking before we started here, OCTA and the toll roads and Metro, those rides don't get taken again. Maybe some of the education that's been lost can be made up, but at the end of the day, there's a whole lot of time that's passed. There's a whole lot of travel and visits to our hotels and visits to our restaurants and visits to our small business that didn't get made. Finding ways to make up some of that lost revenue is an enormous challenge. But we've got to start on it and start soon.
Well, and that brings up a question about where our cities are going to land. So that revenue that you're right, it's gone. So when that revenue is gone, for a city like Huntington Beach that depends on the surfing competition,
right.
And then you have Disneyland, huge contributor to our tax base in Orange County and for Anaheim. What happens with that?
Well, great question, and probably the one that keeps me and my colleagues up at night. And, we may get the economy reopened at some point. We will get the economy reopened at some point. When exactly that is the $64,000 or more question. But finding that all of the travel, for example, and all of the economic activity that's been lost for the last couple of months, does that come back, and how quickly does it come back, is really a tough question. My sense is it doesn't.
Right.
It's going to take some time before businesses are going to feel comfortable, for example, with business travel, business conventions again. It's going to take time for families to say, okay, now I can go take that vacation that we didn't take during spring break in 2020. How long that takes to come back is going to be the challenge all of us are going to face, and encouraging it to come back sooner rather than later is something that all of the cities and all of the local governments have to push for. But that's going to require us to demonstrate that it's safe.
Right.
Maybe we reopen, but we keep social distancing. Maybe we reopen, but we insist on masks or hand washing. Maybe we reopen and we insist on, you tell me, and we'll get the business community to tell us
right.
what sorts of rules and restrictions they can live with that will help assure everybody that it is safe to engage economically again.
And my understanding is it's not, there's the idea of safety, are people comfortable and feel safe? Then there's the idea of that it will be staggered in terms of what's open, and that when we talk about events and large gatherings, those may be put off for some time before they allow those to come back. So that would directly affect anything from a movie theater to a concert.
Right.
So those things may take much longer to happen.
Right. And in some ways, those decisions end up outside of the hands of the Board of Supervisors. Mm-hmm. Right now, we're operating under the governor's stay-at-home ordinance. The question, and it's going to be a legal question as much as anything, is what sorts of rules can we do, if any, that don't follow 100% the governor's particular order? Certainly, we could be more heavy-handed than the governor, But we don't want to go that direction. We want to go
That's
the
not
opposite
you.
direction.
That
That's
is
not me.
this county. So
That is not me. That is not my colleagues. To the extent we can be less restrictive than the governor and the state's orders is something that we need to explore. But it is the right time and the right place to explore that because, as I've said, we are in a better shape, at least medically, than some of our surrounding counties. And if the mayor of Los Angeles or the Los Angeles Board of Supervisors wants to have one set of rules, that's up to them, that's up to their electorate, whether those are the appropriate rules. If we want to have a different set, that's up to us, it's up to our medical professionals, it's up to our electorate what we're going to do. We are seeing in Orange County more of a willingness, and you mentioned the protests, San Clemente, Huntington Beach, a few other places, rightly asking the question, is it time? And if it is time, what does this post-COVID-19 world look like?
So I have a question to follow up on that, but first I've got to do some business housekeeping.
Okay.
So if you just joined us, my name's Arianna Barrios on behalf of OCTax. We are chatting this morning with Supervisor Don Wagner of the County of Orange. And now I'm going to get back to asking the next question, which is on the heels of everything you just said, is the county doing anything specific or looking at any specific programs to help alleviate tax burdens or to help small businesses in the county?
Well, the short answer is yes. The longer answer is a list
Oh my goodness.
that I have, and most of this information is available on the Orange County's website. I printed on scratch paper, Wagner for Assembly. It's somewhat old, but
It's always nice to see that you recycle.
I'm recycling
So-
here. There are a number of places that folks can go. Take a look at the county's website to begin with, and there is a source there for pretty much everything COVID-19 related. I will say businesses can call the Economic Recovery Call Center during business hours, Monday to Friday, 8 to 5. The number is 714-480-6500. If the questions that you might have aren't on our website, call the Business Recovery Center. But we are, in fact, trying to do everything we possibly can to help our local businesses, including, and maybe you'll get to this a little bit later, but the board at our last meeting on Tuesday established an ad hoc committee. Chairwoman Michelle Steele and I serve on it. We are going to be working with our local businesses, talking through the problems, the timeline, and the steps that we need to take, again, sooner rather than later, to start putting this county back to work. But real fast, this is what you'll see on the county's website for small business recovery efforts. And so make sure you take advantage of those resources.
So we actually have a question that came to us from online,
Okay.
and it was, the county will soon receive $500 million. Is that approximately right?
Approximately.
Can this
We're
be-
hoping it's about $550 million is our estimate.
Okay, and is your hope that that can be used for the economic recovery?
That is right now somewhat circumscribed in the uses to which it can be put. And I know the cities are looking for some of that money, and as long as the cities want to put to it the kinds of things that it's supposed to be, but it's not specifically economic recovery. What it is to make the cities and the counties whole for their specific responses from the date of the declaration of emergency through the end of this calendar year. So to make them as whole as possible for specific COVID-19 related expenditures. Things like the masks that they've bought and distributed. Things like the testing that they've done and that we, the county, have done. It's not to backfill budgets. It's not for example, the lost TOT that we were talking about or diminished property tax receipts. It's for explicit C-19 related expenses.
Well, that makes perfect sense.
Which is why I mentioned earlier there is the new paycheck protection and the new economic stimulus that are working their way through Congress. Those are, as I understand it, at least the new stimulus is much more broad in the kinds of uses to which the cities and counties can put it, and that would go for backfilling some of this lost revenue.
Well, and obviously from looking at ways to alleviate pain that people are feeling, whether it's because they've been furloughed or just outright laid off. Small businesses that are devastated, and like you mentioned earlier, money that's just not going to be easy to make up. So you have a lot of response that seems to be very caring and in touch, moving tax day from April 15th to July. And yet there are others who are not quite looking at it the same way. As you know, OCTax has been deeply focused on the split roll initiative that's going to take a whack at, historic Prop 13. That is just qualified on the ballot. Their second try has just qualified. Is that just the ultimate example of being tone deaf, or is it, how do we stop something like that?
When I served in the legislature, there was a saying up there, and it was basically no bad idea is ever dead. Because we would beat a bill and we would find some version of it come back time and time again. That is this on steroids. Not only is it a bad idea in the best of times, you and I both know it's a very bad idea right now. Why it is being pushed makes no sense to me. It is economically illiterate in good circumstances. Nevertheless, there are people who simply won't take no for an answer. They keep coming back because it's an opportunity to grab more and more tax revenue in their minds. I think they'll find it counterproductive, but in their minds, in the minds of the proponents, it is an effort to capture lost tax revenue.
And obviously the tax base that they were looking at to begin with is not going to be the tax base they're going to be faced with after November, whenever we reopen. Well, there are some businesses who are very sadly not coming back.
Well, that's absolutely right. And so it's a uniquely bad time to push a very bad idea. My only hope is the public responds as it should, drums this thing out of existence, and gives to its proponents the cold water in the face that they really deserve.
Well, you and me both. So a lot of government agencies, they establish on top of what you're expecting to get from any stimulus or from the federal government. A lot of agencies put away a rainy day fund. Where's the county on that? We're obviously a much more conservative county. In LA, they're already talking, Garcetti's already talking about furloughing employees. Where's the county in that respect?
The good news is the county is not yet talking about furloughs. At least that's not a conversation that I've heard filter its way up to the board from our executive offices. Will we take that off the table? I've got to say we don't yet know the depth of this crisis. We are seeing, as I say, Orange County in a better shape than the surrounding counties. So it's my fervent hope we never have to get into that conversation. The rainy day fund is a great question, because it is true that everyone from the state on down has tried to put away funds for so-called rainy days. Folks, it's raining. Now is the time to dip into those funds. I had an opportunity to talk last week with a couple of city council members, and they're looking at the hit to their budgets that things like the declining TOT and the declining sales tax has faced, it makes them face, and they recognize that this is that proverbial rainy day. Now is the time to dip into those funds. And there's no question that everybody is going to be dipping into those funds. I will say it's very unfortunate at this point that we saw what we saw several years ago back with Governor Brown, when he ended up sweeping a whole lot of accumulated balances throughout state government and local governments. It was a money grab. It was pure and simple to cover the state's budget hole at the time, and the implications now are drastic. The cities, the counties, the special districts don't have the resources they otherwise would have. But it's raining. Let's dip into those rainy day funds.
Is there anything that you've seen that maybe has been an innovation where you're seeing like, wow, that's not something we did before, and maybe that's something that becomes permanent?
Funny you should ask.
Oh, there you go. Okay. I had a feeling.
The Register ran an article that I put together not too terribly long ago with the great help of my communications director, Rachel, who's here filming this for us. But at the end of the day, there are a number of innovations that we touched on in that article and others that I would like to see. We are being forced to streamline. There is, for example, in the world of telehealth and telemedicine, there are restrictions that have never made a whole lot of sense to me that we're seeing be relaxed right now. And there's no reason in my mind that those relaxed restrictions can't stay with us post COVID-19. A whole lot of other things that ought be done that are being done. For example, we're seeing, frankly, a streamlining of government in just the way it does business. A lot of our meetings are now more online, more accessible online, more accessible telephonically. There is absolutely no reason why we can't see those sorts of limits be relaxed going forward. It makes us more responsive to the public. It makes us more open. So I would suggest we do something like that. And then anybody who's interested, check out my article in the Orange County Register on Sunday. It'll give you a couple of more ideas.
Well, your comments actually inspired Carolyn Kavecci, our fearless leader,
Yes.
to ask a question. There are some things that you can't necessarily do online, or maybe we just haven't figured out the proper way. So for example, for people who need to file, what she asked specifically, pulling licenses or file needed documents with the county, how are we working through those items right now? And do you foresee finding a way that people can at least get into, for limited periods of time, with social distancing, with masks, into some county offices in order to do those things that need to happen?
Well, that's two different solutions to the problem. One is, yes, I do expect in the course of us figuring out how and rolling out a reopening of the county and of all of Orange County, we would have social distancing rules, we would have masks for the people who are visiting county offices, and importantly for the workers at the county desks. But let's get some of those desks reopened. I am seeing our county recorder, Hugh Wynn, again, just over the weekend, he was talking about using what were we talking about? We were using ticket booths at the Honda Center, ticket booths at theaters around the county to issue marriage licenses, because you've got to do those in person. Well, let's do it in a way that protects everybody with maybe some of these glass ticket booths. So some of that innovation is coming just in terms of physical interaction. And we do talk here about making it more accessible, it being any of our permitting process online. We're seeing it. There's no reason why that ought to change. There's no reason why you ought have to traipse into a city hall or traipse into a county administrative office to pull a permit if it can be done online. And we're learning a lot can be done online that formerly we'd been resistant to. We'd never done it that way.
Right.
We're doing it that way now because we have to. Let's keep doing it that way.
It's changing a lot of mindsets, I would
is.
imagine, all the way across.
It is.
So what other resources can you speak to that maybe, you talked earlier about the economic recovery office that people can call if they need some assistance. Are there other resources that people can access through the county? For example, even if we start going back to work, there are a lot of parents who are going to need to be at home because school has already been canceled for the year. What other kinds of resources can the county provide if people are looking for some resources?
Well, the county is in close contact with, for example, the Orange County Employees Association. Just this morning, I was in a text exchange with its president. We are soliciting from them and from, again, through the ad hoc committee that Chairwoman Steele and I are doing, businesses to tell us, what do you need? Because we don't necessarily know what they're going to need. You're going to need childcare, for example. All right, we've got to find ways to make that available, or to at least limit the burden that has on you. One of the great examples that we're seeing are, say, staggered employment hours. If you're able to work remotely, sometimes there's no reason why that remote work needs to be done between 8 and 5. if you need the morning to take care of a child, let's push some of those operating hours and some of those work hours a little bit later. Let's show the kinds of flexibility, and let's get input from the people who need that flexibility as to exactly what they need so that we know what it looks like. We're working through all of those questions literally as we speak.
So we have some people online who are asking
Okay.
specific questions. So Martha is asking, and thank you, Martha, for your question. I appreciate it, about testing and specifically antibody testing. Can you talk a little bit? That was a big issue right out of the gate about people even being able to get tests. But now the idea that antibody tests might tell us who still needs to be isolated and how we can go back to work.
Right. It's my understanding that a number of private labs, as well as UCI, for example, and others, are working on antibody testing. The thing about testing, and this has been a little bit complicated, folks want to be tested. Well, here's the thing about testing. If you're tested and you're positive, you know what you're supposed to do? The same thing you would do if you're not tested and not feeling well. Mm-hmm. Stay home, drink lots of fluids. If in fact you need to go to a hospital, go. The hospitals will do some testing. But just routine testing of everybody when tests were limited and when the need was for those who genuinely were sick and genuinely were in high risk categories. The testing was limited, and so we were urging people not to get tested just if you were curious or just if you wondered, is this the flu, is it a cold, or is it COVID-19? The good news is more and more tests are becoming available, more and more, for example, the antibody tests. They're happening a lot faster. Sometimes you can get results in as fast as 5 minutes. There are false positives, there are false negatives, so we need to be careful with those. But as the private sector, as the market responds, more and more tests are becoming available. And one of the focuses of our board meeting last week was pushing the county to stockpile those tests, make them available. So the idea of more and more broad testing is in fact coming. The idea that those tests are available is what we're starting to see in the marketplace, and the county is behind it, because really one of the things that is going to be necessary to a successful reopening of the economy, as we talked before, is convincing people that it's safe.
Right.
Widespread testing, antibody testing in particular, is the key to that, and so we are now pushing for as much testing as possible as more testing becomes available. As in triaging, you're not denying it to the people who could benefit the most from that test.
On the county site, is there like a resource to tell you where you could get a test if you needed to, or is that just a conversation between you and your medical provider?
There is, as I understand it, on the county website, a number of places where you can go get testing.
So I know just right up the street from where we're at now, they were doing the drive-through testing. So it'd be nice that's to go somewhere and see, where can I go?
There are a number of hospitals, in fact, quite a number in my district alone, and there is a list that is on the county's website.
And do you think that when we do lift the order, we talked about this briefly, but I just want to go back, and this is our last question. Will Orange County do anything different than, say, what LA County is doing or what the governor has ordered? Will we strike out on our own a little bit, or will we kind of march step? Can you answer that question?
I am reasonably confident we will strike out on our own to the extent the law permits us to and to the extent the medical science permits us to. Because as I said, we are in a better position than some of the surrounding counties. Not that I'm casting blame on them. Demographics are different. There very well may be different reasons, but we are in a better shape. And what we want to do is make sure we don't lose that edge. But I do think that gives us the flexibility to be a little bit bolder and to strike out on our own to the extent we possibly can, and that the medical information tells us that we can. I will, though, leave you with this one warning. A little more than a week ago, I was on a conference call with some folks at UCI Medical Center, and I've talked to other hospitals who've confirmed this. One of the concerns the medical professionals are telling us is that because we've done such a fairly good job of getting in front of the disease, we do not have perhaps the kind of so-called herd immunity that we otherwise would like to have. Why is that an issue? Because in the fall, as the temperature cools, we want to be careful that if there is a resurgence of this, we don't go through it all over again and throw away all of our gains. So we have to be very careful. Let's use the next few months to stockpile equipment and PPEs and make sure we have the resources available. If we go through this again in the fall, we don't have to shut down everything. God forbid we do it all over again in the fall and not learn the lessons that we should have learned the last month.
Well, I completely appreciate that, and I think we're all worried about that.
Right.
Thank you so much for spending time with us today. I so appreciate
Pleasure
it.
mine, Arianna.
Thank you for joining us today, and thank you on behalf of OCTax. I'm Arianna Barrios, and we will see you next time.